First of all, welcome on a Saturday morning. और आप लोगों ने time निकाला and you all came here. That's excellent. Thank you so much for that. Really appreciate. And this is Coffee with CMM seminar number 10. We started last year I'm just saying for the people who are here for first time and they don't know what we did before. So we do sessions every month on a regular basis, and we also arrange main events as well. International Women's Day is our main event of the year, but we do hold like one or two other events like community events, music events or something like that, just for community engagement and entertainment. Today we're going to talk about foot care, and I will introduce Meena in a bit. But before I go forward, I would like to just explain some housekeeping rules. This is a new place, maybe some people are not familiar with it. This is the fire exit. In case of fire, you can just exit from here in the car park. And the toilets are right at the back, just the door behind, so they're straight there. And there are some ground rules. I mean, we have experienced a few issues, not here, but in one or two, when people talking over each other in Q&A session. So how our session runs is that we have the speaker giving us talk for like 20 minutes, half an hour, and then we have a question and answer session where you can ask questions. But I would say that please ask one question at a time, and so that our expert can explain, and then we can record and everybody can understand what's happening. So we're not like talking over each other and question on the question, but one at a time, please. And we need to respect the speakers and the Creative Minds Media team, and also let us know what are your expectations from our team, from our group CMM. Hi, so some members coming. In the last session, with the contribution, we raised £66.50, which obviously paid for the rent of the hall and the refreshment. And also we bought one equipment, we bought a flask. Although it was not enough, but obviously it makes a big difference because we haven't got any funding yet, we haven't applied for funding. We're looking into that, but this is a totally self-funded organization, which I'm funding myself since a year and a half. So that's why we collect contribution, if that's okay. And thank you so much for your participation and your contribution. So let's get started. I've got Meena Afzal with me. Meena is a qualified podiatrist, and she's a registered podiatrist with the HCPC? You have to explain that to us, the organization HCPC.
It's just the Health Professions Council for podiatry, so you need to have registration with them to be able to work.
Oh, okay. Excellent. So Meena is going to talk about foot care and his health conditions related to it. Any questions afterwards, so you can, by all means, you can ask the questions. So over to Meena now.
Thank you, Farzana. Assalamu alaikum, everyone. Thank you. How are you all? Thank you. Alhamdulillah. My name is Meena Afzal, and I'm a podiatrist by profession. I've been working for 15 years. Thank you. I have been working for the NHS as a specialist podiatrist, and I'm also doing some private work as well since the last 2 years. Today I'm going to talk about foot conditions. Before I start, I'd like to take this opportunity, with it being the last 10 days of 10 days of Zulhijjah. I just wanted to start off by making dua for everything that's going on in the world, especially for the children of Gaza and everything that's going on. May Allah SWT make it easy for them, and may Allah SWT guide us and give us the opportunity to make use of these 10 days. Hopefully Eid Mubarak in the end. Everybody has a nice Eid, inshallah.
You do.
I started working for the NHS as a podiatrist, like I said, 15 years ago. And I started off very nervous. I did not know what I was doing, and I've come really far in the 15 years. I have worked with diabetes specialists, consultants in hospitals. I've worked with rheumatology consultants in hospitals. I also have done my master's in foot surgery. I wasn't able to carry on doing that because of family commitments. You have to travel around the world. But yeah, this is my background. So today what I'm going to talk about is problems associated with feet. First, I would like to know how many people know a lot about podiatry, or has anyone had any podiatry treatment? Yes, perfect. Okay. I think with Asian community, Pakistani community, we don't come across podiatry that much. We don't have a lot of insight about what podiatrists do. I think that most people think that it's just nail cutting, and that's all it is. We do a lot of other things. So we diagnose and treat foot problems by using physical exams, and we use tests to identify issues with your feet. Has anyone here got any foot conditions or any foot problems? Okay, we can go through them in the end. Okay, what I also want to do today, it's up to you if you want me to do it or not. I have a device with me here, which I can check foot pulses with. So foot pulses, we do that. We do a general assessment. So when I first see a patient, I will do an assessment of your feet. I will check foot pulses. I will check for the feeling in your feet. So if anybody wants, I can do this in the end, or it can tell a lot about your heart and how blood is flowing through to your body and to your feet. When I do this in clinic, a lot of times we can find patients who have heart conditions that were undiagnosed for a long period of time. So we refer them to the GP. Conditions such as atrial fibrillation, conditions such as arrhythmias or irregular heartbeat, for which they do require medication. If they don't get the medication, they can end up having a heart attack or a stroke. These conditions usually don't have any symptoms. So if you have atrial fibrillation, you probably would not know that you have it unless it's quite bad and you get palpitations or anything like this. So if anybody wants me to do that on their feet in the end, I am more than happy to do that. How many people here are diabetic? Do all of you have annual diabetic foot checks? Okay. Yeah. So why you go there and yeah. Wonderful. Okay. So we treat everyone. It's not just the elderly. We do see a lot of elderly patients, but we treat everyone. So we do biomechanics, we do verrucas. I think NHS doesn't do verrucas anymore, and GPs don't do verrucas either, unless they're problematic. So if they're problematic, they refer them to dermatology, and they can do cryotherapy, or needling, or something like that, or acid treatments. As a private podiatrist, I can do that as well. So that's verrucas. And then we also do nail surgery. Nail surgery, has anyone ever had an ingrowing toenail, or does anyone know if anyone's had an ingrowing toenail, or does anyone know what it is? Yeah, okay. So ingrowing toenails are, to be honest, not going to be seen by NHS podiatry in the near future, unless they're problematic or there's an infection. So they're probably going to be mostly privatized. Started to dig into your skin, causing problems, overgranulation of the skin, and it can sometimes cause infections as well. So for ingrowing toenail, what we can do is perform nail surgery. What that requires a local anesthetic in your toe, which will numb your toe, and then we'll just take the side of the nail out. We don't have to remove the entire nail. It can just be just part of the slither of the nail that needs to come off, or it can be a total nail avulsion, so we can completely remove the nail. We use a chemical called phenol, and then it completely kills the nail cells so they don't grow back, if that's what the patient wants. Or if the patient wants to try and see if it grows back normal, they can do that as well. It's their choice. Also with fungal nails, we can perform nail surgery. So if fungal nails, cosmetically you don't like the look of it and you think, you know what, I want to do something about it, there are treatments for fungal nail. But a lot of the time, if it's medication, the GP won't prescribe it because it is not good for your, it's quite a strong medication and it can affect your liver. So the GPs don't really like to prescribe the medication. The only other options are over-the-counter nail paints or nail lacquers, which don't work. They don't work. So we just say either if it's not bothering you, leave it. But if it is bothering you, then either you can come for general podiatry on a regular basis, 6 to 8 weeks, where we can thin it down, or and then you can have some nail. As Muslim community, we don't really like to wear nail polish. But you can paint your nails if you want to, or you can have the nail removed completely without using the phenol to kill the nail cells, and then just wait for it to grow back and see if it comes back normal. So that's also for fungal nails. We can do nail surgery for that as well, as long as you don't have any underlying health conditions or your diabetes, your HbA1c levels are good. So if HbA1c levels down. We also perform annual diabetic foot checks. So people with diabetes, if their blood sugar levels are quite high, they can get problems with their feet over a period of time. What happens with diabetes is if you've got a lot of sugar in your blood can become quite thick and sticky. So if you're making like a caramel syrup or something, and you're putting lots of sugar in it, it can become quite thick and sticky, and it can clog. It's the same with your blood. So what happens is if your blood is quite thick and sticky, it can clog up your arteries. What that does is it causes problems with the circulation. So it can clog up your arteries, causing problems with the circulation, leading to atherosclerosis, if developing wounds. So if you're a diabetic, your sugar levels are high and you have a wound on your foot, it can cause problems. It can lead to infection, gangrene, if the circulation is not good.
Sorry a minute, just a little pause. I should have asked, shall we just continue in English or a bit of Urdu as well? How would you prefer?
Just continue.
Yeah, is that okay with everyone?
I can speak in Urdu if you want me to. I'm completely happy with that. But are you happy with what I'm discussing right now?
Okay, thank you. Thanks.
Okay. So with diabetes, you can get a lot of problems with your feet. We do tend to see a lot of wound ulcers, gangrene and stuff. And I think patient education is really important. A lot of patients we see are not really well educated when it comes to diabetes and their feet. So diabetes can have an impact on your health, it can impact on your feet, and if your feet are not good, you're not able to walk around, you're not able to go outside. What we tend to also advise is pressure relief. So if a patient does have a diabetic foot ulcer, we say try and stay off your feet, elevate your feet and your legs, and then we refer them to the correct team, for example, vascular or diabetic team, to see whether there's any procedure they need to improve the circulation. Now, talking about circulation, there's also something called intermittent claudication. Has anyone heard of it? Okay. So intermittent claudication is, you tend to see with patients who have peripheral arterial disease or narrowing of the arteries. So say a patient is walking and they can only walk for like 100 yards and that's it. Then they start to get a lot of pain in their calf muscles, which tells you that they're not getting enough oxygen supply, enough blood supply to the lower limbs. So what we tend to advise in that scenario, so when patients come and see us with this sort of scenario, we tend to advise that you need to continue walking. So, if you think about it as a motorway system, so you are using the motorway and you want to take an exit, but that exit is blocked off. You need to try and take a different exit or find a different route. It's the same with your blood supply. So if you have a blockage in your artery and you're walking a certain distance and you're getting that pain, what we tend to advise is carry on trying to walk. What that will do is it will make some more smaller blood vessels in your body, and it will help you to walk a further distance with time. And we will also refer you to vascular to see if there's any intervention that they need. So that's intermittent claudication. And normal things we can treat corns and calluses. I don't know if anyone here has had a corn. It can be quite painful if it's on a nerve. So yeah, we do that every 6 to 8 weeks, just remove it. You get corns and calluses because callus is formed because of pressure. So it's the way you're walking, which might mean that you might need some, if it's problematic, it might mean that you might need some insoles, wired insoles.
I have had insoles.
Yeah, yeah. So we do a lot of biomechanical assessment. It's quite lengthy. We have to assess the way you're walking, so your gait. It can be lots of different reasons. Maybe your footwear is not right, so we can advise on footwear. It could be that you have more pressure on a certain area, and having an insole with a wedge or something will help reduce that pressure on that area and improve your walking. So we can prescribe insoles for such reasons as well. Sometimes people might have a leg length difference. So what a leg length difference is, if you're walking and you're getting a lot of pain maybe in your hips or in your knees, and you don't know why you're getting this pain, and nobody can give you a diagnosis, sometimes we say, you know what, ask your GP to refer you to a podiatrist who can do an assessment and see the way you're walking. And then if it is to do with biomechanics, we can add maybe a heel raise or something in your insole, so that when it will help with the leg length difference. Has anyone heard of anyone having a leg length difference? Yeah. Okay. So yeah, it can affect people differently. But sometimes it's quite prominent. Sometimes your shoulder, you might not realize you're walking and one shoulder's lower than the other, and then your hip as well. If you're wearing a skirt, or if you're wearing a shalwar or a trouser, people don't look at these things, but these are the things to look at. So on one side, the trouser might be a bit higher than the other, so it could be that there's a leg length difference. Okay.
Yes.
Yeah. We don't tend to treat every biomechanical problem unless it's symptomatic, unless there is a problem. So that's biomechanics. I've got some pictures here. Now I don't know how, we don't have a projector or anything, but I was talking about skin cancers and melanomas. I'll just turn the computer around to see if you can have a look. Yeah, so here we have a subungual melanoma, even on fingernails, so you don't have to worry about it. But sometimes it can be nail cancer. So it's always good to have it looked at. If you've got anything like this and it's either increasing in size or it's uneven and it's a new mole, or even on your skin, it's a new mole, then it's best to have it checked by your GP. It can be anywhere on your body, not just your feet. So when it comes to your skin, okay. So here's an example of a melanoma on a person's foot. Okay. So I'll just turn this back around. So do we know a lot about skin cancers? And did you think that podiatrists might be involved, might study this? Yeah. So yeah, we do a 3-year course. We study a 3-year course, and there's a lot of topics that we talk about. So there's a lot of dermatology as well that we do. When we do notice these things, of course, we refer them to dermatology, and then they do what they need to do. So the main causes of melanoma, I think we probably all skin cancers, is sun. So if you're not wearing, your protection, your creams and stuff, so that's quite important when you're out and there's not much sunshine in the UK, but if you are going abroad or to Pakistan or something like that. Things that increase your chances of getting melanoma include your age and having pale skin, a large number of moles, and a family history of skin cancer. It is often possible to prevent skin cancer by being careful in the sun, like I just said, and using sunscreen and applying it regularly. How they are treated depends on where the melanoma is. If it is spread to other areas of your body and general health, surgery is the main treatment. Okay. There's also a condition called Morton's neuroma. I don't know if anybody has heard of that. It is quite a common condition when it comes to the foot. So what that is, you can get like a little pain in your digits, under your second and third digits on your foot. When you're walking, it's very, very painful. And there's a test to diagnose that. So what we do is, if I had a foot, we squeeze the foot, and if we hear a click, that means that there's a small neuroma in your foot. If that is the case, then they can, the GP can either do some injections, some steroids, or they can do surgery to, not the GP, but the orthopedic surgeon or the podiatric surgeon can do surgery to remove that. So that's it. How many people know about pressure ulcers? Pressure ulcers. Pressure wounds or ulcerations. So if a patient, this is about elderly patients. This is to do with a lot of elderly patients. So people's mums and dads or grandparents and stuff who are housebound and they're not able to move, so they sit in one position all day long. These people can develop pressure ulcers on their feet. What pressure ulcers are, they're caused because of lack of oxygen supply to that area. So if I show you, if I put a lot of pressure on my hand for a few seconds, it's going to go yellow. It's going to go yellow because there's not enough blood supply coming to my skin. So if a patient is sat in one position for a long period of time, they're not moving around, their skin is going to break down over time. The different grading of pressure ulcers, they are preventable. There are barrier creams that you can use for pressure wounds and stuff. Every couple of hours, if there's anyone at home, daughters, sons, grandchildren, try and move. It's not just on feet, you can get pressure areas on your bum, on your back or anything like that. Most common sites on your feet are your heels, because you're sat down constantly on the heels, and we do see them a lot. And once you develop a pressure wound, it is very difficult to treat and it takes a long time for it to heal. So we do tend to say that, if someone is completely bed-bound or chair-bound or is sitting in a position for a long period of time, change their position regularly, every 2 hours if you can, to prevent any pressure sores. And I think that's it really. I think I've touched up on a lot of things when it comes to podiatry. I've touched up on, so diabetes. Rheumatology is another condition that can affect your feet. Because of rheumatology, you can get pressure ulcers because of the shape of your foot. And with rheumatology, there's also gout that you can get. You can also get gout on your, in your joints. Okay, so the test for that is a blood test where the GP will, or a urine test where the GP will check for your uric acid levels. And we do tend to see a lot of patients with gout, and there's a lot of joint destruction when it comes to gout, and it can be very, very painful. If I see that in a private clinic, I will refer them straight to the GP. To be honest, in podiatry, as a private practitioner, we can see patients on a regular basis who have wounds, but if we have any concerns, then we will refer them to the NHS. And there was another point I just thought of now, and it's completely gone out of my head. Sorry. If it comes back, I'll let you know. But if there's any questions about podiatry or about anything, then please.
We can take questions now. So
Yeah.
I'll pass the mic to you.
Hello.
Hi.
Assalamualaikum.
What cause of the growing a nail fungal?
Well, fungal nails is to do with age, so it's very, very common. It's not. Sometimes it's to do with age. Sometimes it's just, you know, if you go swimming or if you caught it from somewhere else. But most commonly, we do see it with kids as well, and it's very easily spread. So it can spread to your other nails as well. So what we tend to say is, for care, if you do have fungal nail, cut that in the end. So if you've just got one fungal nail on your foot, do that in the end, and then first do all the nails that don't have any infection. That would prevent the other nails from catching
Even
the
if
infection.
the clean socks, clean feet, no smells, nothing,
Yeah.
no sweating.
Well, okay. Sorry?
Still, it start growing a nail fungal, so that's why I'm worried
It
about
can.
Yeah.
It can, yeah.
Normally when
Out of nowhere. It's to do with your health as well, so your health condition, how your health is. It is to do with the environment. If you're wearing socks a lot as well, that can cause fungal skin infections. Yeah, sweating ke saath you can get athlete's
no
foot.
sweating, clean, very clean, tidy, no smell, nothing. Still, it start growing a nail.
Yeah, even then, fungal nails are very, very stubborn. If they come, they will take a very, very long time to go.
The second question is what's the cause of the plantar fasciitis?
Plantar fasciitis, yeah. So plantar fasciitis is a condition where you've got four layers in your feet. Plantar fascia is the last layer, which holds all the muscles together in your feet and the arch. So what happens is, I had plantar fasciitis when I was pregnant. So sudden increase in weight can cause plantar fasciitis. If you carry something very heavy that you're not used to carrying, can also cause plantar fasciitis. Wrong shoes. I've had plantar fasciitis twice. One was because of an increase in weight, and one was because of wearing the wrong sandals. I had the worst pain in my feet. So footwear, increase in weight, or what was my third point? I can't remember. Yeah, so these are the things that can cause plantar fasciitis, and footwear. So with footwear, what we tend to say is, if you do have plantar fasciitis, wear something a bit more supportive with a lace up or a Velcro strap for the time being. And there's plenty of exercises for plantar fasciitis that you can do yourself. Do you know anyone that has it? Do you have it? So are you doing exercises?
How you spell the word?
Sorry?
How you spell the word?
Oh, Plantar. Fasciitis, FASCI. TIS. Yeah,
It's a long word.
it is.
I couldn't find it.
Are you performing exercises?
Steroid injection.
Oh, you've had steroid injection.
PRP, then the finally electric shock treatment.
Oh, okay. And you're better now? Yeah. So what we tend to say with plantar fasciitis is, first line of treatment would be exercises. So we give you quite a few exercises to do. They're very simple. You can do them at home. We have, does it not? Yeah. On some patients it doesn't work, and on some patients it does. It can take a while. You have to do the exercises on a regular basis with any, if you've got tight coughs or anything, strengthening exercises you need to do regularly. But on some patients it doesn't work, like yourself, and you need further treatment. So now that we're talking about plantar fasciitis, I can tell you some basic exercises if anyone does ever end up with it. Do you? Yeah. So plantar fasciitis, the diagnosis of it is when you're relaxing, when you're sat down, or when you've just woken up, that's when you feel it worse. That's the pain is really bad. You can't even put your foot down. That's how bad the pain is. So that's why we say first thing in the morning when you wake up, do your exercises. So you can have a bottle of water, put it in the freezer, and then in the morning, get someone to bring it for you, or if you have to get it yourself, you know. But you roll your foot on it, start from the arch and then roll your foot on it. And then get a scarf or something. Once you've done that, do that for a few times. And then once you've done that, get a scarf and then pull your foot towards you. So you're stretching that muscle. You can also do that, and then you can go against the wall and do some stretches. Yeah, I can show you that later. So yeah, these are just basic exercises that you can do, but if they don't help, then the last case scenario would be steroid injections. Yeah.
Right, and we got next question, Rabina. You have a question?
Yeah, I've got a friend. I have a friend who has. I spoke to her last night actually. So she had. She thinks she doesn't have a nail fungal problem, but her nail, when it was coming, it will just not sticking to the base.
Okay.
So it was just, and then eventually now what's happened is. One of her nail only half grows, and one does not grow, I think, or there is no bed under the nail. Does that make sense?
Yeah, so you're saying it's a bit raised and it's not sticking to the skin.
Exactly.
Okay. Has she had any trauma to her
She
feet?
does see
Podiatrist.
Specialist. We were just wondering why this was happening, and if there is a cure for it.
Yeah, so we see, I do see some patients with what you've described right now. Sometimes when I have a look at their footwear, it can be quite narrow, and it might not be deep enough for them. So they have, when they're walking, they have that constant pressure on their nail. So if it's constant trauma, it can cause what you're saying, lifting of the nail and stuff. Sometimes it might just grow like that. Nails do very funny things with age. They can sometimes it's not even a fungal nail, it's just quite a thickened nail. And it can, that's probably why it's just growing halfway. Is it quite a thick nail?
I don't know, but she said it's only growing halfway, and they have suggested that they can put an artificial nail in front of that nail, and which will last for 4 months, and she'll have to do it again. I mean, she's not bothered about that. But I was just wondering why it will not grow fully. Is there anything that can be done to make it grow fully?
Nail surgery.
Okay.
Well, she can try having nail surgery so she can have it completely removed without the phenol, so don't kill the nail cells. Once it's completely removed, let it heal, give it time, and then see if the nail grows back normal.
Okay, thank you.
That's what she can, yeah.
Thank you.
Okay, thanks.
Anybody else?
मेरा नाम आसिया है
जी
और मैंने थर्सडे पेडियाट्रिस्ट को देखा है
जी
तो मुझे एथराइटिस है, ऑस्टियोआर्थराइटिस। तो मुझे चलने में काफ़ी प्रॉब्लम है।
अच्छा।
तो चलने फिरने में भी कई दफ़ा ज़्यादा देर बैठ लो तो फिर दोबारा खड़े
स्टिफनेस हो जाती है।
तो एक मेरा नेल जो है पाँव का वो डिस्कलर है, लेकिन फंगल नहीं है उसमें। तो उसके लिए मैं वरीड हूँ, क्या किया जाए?
डिस्कलरेशन की वजह से अगर फंगल नहीं है तो रियली हम कुछ ज़्यादा कर नहीं सकते। अगर सिर्फ डिस्कलर्ड है तो आप कोई रीज़न है? कभी कोई चोट लगी हो?
याद नहीं है कि चोट लगी थी। जी चोट का याद नहीं है, लेकिन दूसरा साल है ये।
अच्छा,
लेकिन
2 साल तक तो नहीं रहता।
भी आ रहा है, लेकिन वो भी उसी तरह से आ रहा है। अभी बीच में एक डेंट आया है।
अच्छा, मैं बाद में देखती हूँ, फिर आप मुझे दिखाना, फिर मैं देखती हूँ।
थैंक यू।
ठीक है, ओके।
नहीं इसमें नहीं है because we're recording है।
Yeah, मैं like I said, anybody who wants to come to me and want their feet checked, I'm here. You can, and I'll have a look.
It's Anila here.
Yeah. Assalamualaikum Anila.
So my question is कि जो referral है to podiatrist, is it good? Is it self referral होता है या is always through the GPs, especially patients who are diabetic? And if they have feet problems?
Yeah, so you can do self-referral.
On NHS?
On NHS, yeah. And you can also get your GP to refer you. So it's both.
Okay.
Yeah.
So self-referral is quite easy.
It is quite easy, but you need to look at the criteria of your trust, because they won't accept you unless there's you fit the criteria.
Okay. So it's via online? You can do it online?
Do you live in Tudor?
No, I live in Derbyshire, but I'm
Derbyshire,
just
okay. You'll have to
wondering, you know, if it's...
You'll have to look on their correct, because I don't work for that trust. Every trust is different.
Okay.
Some trusts only say that we'll accept GP referrals. Some
Alright.
trusts say
So they
that
will
we
say- okay.
we will accept, you know, you can do self-referrals as well.
Okay, so there was information on the website then? On
There
the
should be
particular
information on the
trust.
website. Or you can ring the podiatry directly. They should have a number. And they can advise you. Yeah.
Okay, thank
Sorry?
you for that.
I think you're asking for the NHS.
Yeah,
aren't
I'm
you?
asking for the NHS.
Yeah.
Okay, thank you.
What's the issue?
Because I've got a lot of, because since I'm diagnosed with diabetes, I'm noticing I'm also suffering with plantitis. I can never pronounce that.
plantitis. Okay.
Yeah, but also feet problems since I'm diabetic.
So do you not have
ingrown and
Yeah. Ingrown toenails.
yeah, and others which I never know. You know, I did not know
Yeah.
where they're coming from.
Mhm.
So I thought, you know, I really need to pay attention to that.
Yeah.
But I did not know if self-referral could be done or whether I need to go to the GP. So it's good to know that we have both options to explore.
Yeah, because for the trust that I work for, I work in Wellington, and when it comes to biomechanical issues, a podiatrist can do the referral, or the referral needs to come from the GP.
Yeah.
So it's not a self-referral.
Yeah.
Yeah.
Okay.
So you'll have to check with the trust.
Okay.
Yeah.
Thank you very much.
Okay.
Anybody else?
Question. My husband is diabetic. He's over 85, and they've recently changed his medication. And I've seen blisters coming on his legs.
You've seen what, sorry?
Blisters
Okay.
coming on his legs. I know it is not a podiatry matter,
Yeah.
but he's chair-bound. So he's... how do I check his feet for things like I was saying?
Why has he got blisters that come on his? Has he got edema? Has he got swelling?
It's severe now. Yes.
Oh, right, okay.
And we were in Pakistan for 4 months and there was no edema. Now he has.
Is it since the medication?
I think
Oh,
so.
okay.
Think so.
Is he on any water tablets?
No.
Okay. Well, that I would say speak to your GP, and especially if he's got edema. Sometimes you can get compression stockings if your circulation is good. That he can wear, or compression. They have these really good compression straps now. So sometimes it's hard for patients to put on compression stockings. What they have is these straps where you can tighten them yourself, and they're quite good. Especially if he's getting blisters and if they're leaking, they can cause a problem. Yeah.
They're not leaking, but I haven't seen blisters before. So I have to take him to his doctor.
Yeah, I would advise you to take him to the GP. Yes. Yeah.
Anybody else?
Yes.
So this plantar
Fasciitis.
I can never pronounce that. So once we have it, does it never go away?
Oh no, of course it goes.
But I had it for years, so I mean I can walk. It's the pain is not there, but it's hard. No, I cannot wear hard sole shoes anymore.
Yeah.
Most of the
Have you had
time.
any insoles?
I
Maybe
use
you need
insoles,
insoles.
but I cannot wear. People wear these beautiful sandals with hard soles. I cannot wear them anymore, so because it starts to hurt. So I wonder whether it ever will, or is we just have to just keep exercising and live with it.
No, plantar fasciitis is a condition that does not stay forever. It can go away. But if it doesn't go away, then you can get steroid injections and other treatments.
So does it heel underneath? Is it normal to feel hard?
With plantar fasciitis, you can get a heel spur as well. So
Yeah.
so that's a bone growth. So if you get a heel spur, that might be causing the problem. That will be seen in an X-ray.
Okay.
So you might need to ask your GP if it's under the heel to see if they can do an X-ray. And if that is the case, sometimes they might need to shave that bone off or something.
All right. Okay. Thank you.
Okay.
There are a few people who've said
Yeah.
it did work for them. So I don't know if it really worked for them, but there are a few people who have benefited.
If they've been used, I don't know, they might have used it for a very long time.
It's been taught for a year or 6 months at least.
Well, that's good if it's worked for them.
Yeah.
I just say it's a waste of money. It's like £20 or something, isn't it? Yeah. £25,
There's
£28.
bound to be something that can be done about the nail fungal infection, which is very common. And so what else can be done? Is there any herbal stuff that we can use?
Do you know, a lot of my patients have tried different things. Something that Vicks does the trick.
Vicks?
I don't know if you've heard of it. Does it? This is just a myth. I don't know if it is. Tea tree oil, Vicks. Someone's come out with garlic. So if you cut the garlic in half and just put that on, some patients say that it's worked for them. So it's just trying different remedies to see what works for you. And they're free.
Yeah, I just remember something that it might benefit somebody else. When my son was born, he had a cradle cap.
Okay.
Yeah, it was really bad. They tried all sorts. And one of the midwives who was very good, she said, just put some Vaseline on.
Mm-hmm.
Just put Vaseline on a few days. It disappeared, never came back.
Yeah.
So it was so beneficial. So let's hope this Vicks.
So Vicks or garlic or tea tree oil. There are different things that you can use that are in your house and see if they help. It depends if you can afford the fungal treatment, then go for it and see if it goes away. Give it 6 months, a year. But fungal nails are very, very persistent. They stay very stubborn. Yeah, they can stay for a very long time.
Thank you.
Okay.
What were the tablets that they give?
Tablets, like I said, they're very, very strong. It's called terbinafine.
They are very strong.
Yeah, they're very strong. It's a very strong medication. So maybe for the younger generation, the GP might prescribe it. They do work because they're very strong. They do tend to work, but they won't give it to patients who have health conditions because it can really affect your liver. Yeah, to that medication as well.
It's
Yeah,
worth it, is it?
it's not worth it. No. Yeah.
Any more questions?
Do you guys know about neuropathy? Do you all know what neuropathy is when it comes to diabetes?
Yeah, I've been to for the neuropathy
Have you?
as well because
Yeah.
they said it's very, very thin, tiny because of larger veins from the upper body.
Yeah.
This goes through to the bottom, under down, under legs, in the feet.
Yeah.
Very tiny, like a hair bulb, the hairline. So they sometimes when they're standing all day, so they
Yeah.
can change for a job, kind of job, different kind of job, doesn't stand. So it's just gone damage. It's gone damage. That's caused pain. Yeah.
So neuropathy can be related to diabetes, or it can be related to back problems as well, because all your nerves are coming down from your back, or if your back is impinging on a nerve, you can get sciatica as well. Sciatica, you can get tingling and everything in your feet. Now, neuropathy, when it's associated to diabetes, it can be quite problematic for patients. It can keep them awake at night because they can get this burning sensation in their feet. This happens if your blood sugar levels are really high and they've been high for a long period of time. So like I was saying, if your blood can become quite thick and sticky. I think the example I gave you, if you're making syrup and you've put so much sugar in and stuff, it's the same with your bloodstream. So when it comes to your bloodstream, the arteries clog up and it affects your circulation. It will also clog up in your extremities, so it can the excess sugar clogs up in your extremities, so your feet and your eyes can get affected. Hence, you get annual eye check as well to see how your eyes are working. When it gets clogged up in your feet, it affects the nerves in your feet, and it will damage the nerves in your feet, and it will lead to loss of feeling in your feet. So that's another really important symptom that everybody needs to look out for. I've had patients come into my clinic with a nail stuck in their foot. maybe for 2 weeks or more, and they've not felt anything. Okay, so now they've not felt anything. They have a really hot, swollen foot, which is really badly infected, and the only reason they've come in is because, and what I don't understand is they don't look at their feet. They don't look at, it's like their foot is really hot and swollen, and they only come in when they're generally starting to feel unwell. So like, you know, if they're septic, if they're becoming septic, that's when they're coming in to, you know, come, and then we just have to send them to A&E. There's nothing else we can do. With diabetes, with poor circulation and neuropathy, if you have a cocktail of things, it can cause Charcot foot. Charcot foot is where your foot completely collapses. It's very dangerous. You need to go straight to hospital for that as well. You get a very hot foot where you don't feel any pain. You don't have any, and your circulation is not that good either. I've seen only a couple of patients in my lifetime. I've been 15 years of work. But you have to go in a cast if that is the case. Otherwise, it will completely destroy the shape of your foot.
The entire nail.
Yes.
How long does it take to heal? And also, can the person walk? Like
Yeah.
Normally.
Yeah. So the nail surgery procedure takes about an hour. So the nail surgery procedure takes about 1 hour to do, and it takes, if it's a complete nail removal, it can take up to 3 months to heal if you're causing a chemical burn. So if you're using the chemical to burn the nail cells so they don't grow back, it can take up to 3 months to heal. If you're not using that, then maybe about 2 months for it to heal. You can, we say, rest on the day, and then after that you can go back to your normal routine.
We can wear trainers, shoes.
Yeah, you can walk normally. It's a very thin dressing. On the first day of nail surgery, we have quite a padded dressing because of the bleeding. But then we will see you the next day or the day after, and then change the dressing. And then after that, you tend to do the dressings yourself until it completely heals.
Thank you very much, everyone, and we come to the end of our session. Thank you so much, Meena ji.
No problem.
A big round of applause for Meena.